Thanks for coming in today for your cranial nerve exam. I know it was tough to get here with the traffic, but now you are here, so we are going to get this cranial nerve exam done quickly, but in a proper way, because we have your surgery coming up in a few weeks' time, and we need to make sure that all the nerves are right in your entire body, actually, before we send you off for that surgery that you're going to be getting on the backside of your head. So I've got a 10-step process that I'm going to be doing today. It's not hard. You just have to relax, make yourself comfortable. I will be doing the exam on you today, and I hope that's all right. Okay. So the first thing that we need to do is we're going to be doing your visual acuity, your visual fields. This is going to be looking at cranial nerves 2 and your optic nerve. So I just need to get my light, so 1 second. Pardon me, I just dropped my stethoscope. This whole thing. So I'd like you to look at me, and we're going to go through a series of steps to make sure that your visual acuity, cranial nerves 2 of your optic nerve are good. So when you see the light, let me know. Great. And the other side. Great. From the bottom. Great. And the top. Great. I'm going to be coming in from a side I'm not telling you. I want you to tell me which corner it's in, okay? Great. Excellent. I'd like you to follow the light down and then up. Following along. Great. Following and following. Top to bottom. Following along. Great. So far your cranial nerves are looking good. I'm just going to do a couple pupil tests to make sure that your pupils dilate. We're going to be checking the pupil size, the shape, and the reaction to light. This is testing your cranial nerves 2 and 3 with the optic and oculomotor nerves, okay? Alright, so just cover one eye for me. I'll give you this tool actually right here. What I want you to do, I want you to cover one eye just like that. Okay, so I'm going to hand that to you. Great. Now, have that eye covered. I'm checking your pupils to see if they dilate. Okay, that tool that I gave you, can you put it on your other eye now? Great, coming in on the other side. Are you ready? Perfect. Okay. Okay. Just checking the pupil size and reaction to light. Again on the other eye. That is excellent. Your eye movements are great. I'm just going to be doing a couple more and then we'll move on to the next one. Firstly, though, I just need to write these down in my book. Just notes for me to take note of for when we bring you into the surgery room in a couple weeks' time for your exam. Okay. Alright, with that being done, can you please tell me how many fingers I'm holding up? How many fingers did I do? Okay, how many fingers again? Did you see that time? Great, your nerves, your reaction to looking at how things move is doing great. I just need to check the shape of your eyes now. I just need to get my light again. Can I have you look up for me, please? I'm just gonna come in here. And I'm just peeking up into the topper part. Can you look down for me now? Okay, so just... That's excellent. Look up for me again. I'm going to look into the other eye now. Okay. I like what I'm seeing. Look down for me again. Okay. Can you tilt your eyes to the right? Okay, just having a look on that side. Now, go cross-eyed for a second. Okay, go cross-eyed one more time. Excellent. And look the other complete opposite way now. That's great. Okay, so I like what I'm seeing in your eyes, the shape, the entirety of them. They're doing great. So now we're going to be moving on to the cranial nerves 3, 4, and 5, the ocular motor, the trochlear, and the abductive nerves. These look at your eye movements and coordination. So I'm just going to get another tool. I've got my 2 tools here. I'd like you to follow along with them in the directions that I go. Do your best so that I can make sure that your eyes both move in conjunction with each other, okay? Alright, so. Okay, I tricked you on that one. Our eyes can't go in both directions opposite to each other. They could, but that would be a little weird. Okay, here we go. So just follow where this goes. Okay, follow it. Great. Follow. 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 Excellent. Now, I just want you to follow along, but I want you to tell me when it leaves your peripheral sight, okay? Okay, so tell me when you cannot see them anymore. Okay, and again. And again. And again. And again. Sorry, I didn't mean to hit your nose there. That was great. So far, you're doing well in the entire eye section, so I'm happy that those nerves are all intact, because where we will be doing our surgery in a couple weeks' time, we will be near those cranial nerves, so that's excellent. Next, we're going to be doing facial sensations. I'm just going to be touching certain areas of your face, testing the strength. These are cranial nerves 5, 6, and 7, the trigeminal and facial nerves. So I'm just going to get another tool for that. So I have 2 pencils here. One is the eraser side. It's dull. The next, the other side. It's sharp. I'm going to touch certain parts on your face, and I want you to tell me if it was prickly or soft, okay? Alright, so I've got 2. I'm going to be touching either side of your face. You tell me which side it was on and whether it was prickly or if it was soft, okay? Great. Okay, here we go. Prickly or soft? Okay, prickly or soft? And again, prickly, great. I was just doing it on your nose there, so if you felt that, hope that was okay. There's a little bit of a pencil mark on your nose now. I'll get that off afterwards. Okay, again, we're going to go through it again. Prickly, soft. Okay, coming up into the forehead area. Okay. Prickly or soft? Okay, coming into the cheeks now. Okay. Prickly or soft? Prickly or soft? Prickly or soft? Prickly or soft? Great. There's a couple more I'm going to do on the lower portion of our jaw. Okay, so I'm just coming in now. Again, there's going to be quite a few times where I repeat myself, but it's all just to know whether it's prickly or soft, so I can see how your nerves are reacting to touch. Okay, here we go. I'm just touching down near your jaw area. Okay. Prickly or soft? Prickly or soft? I'm going to do both sides now. Prickly or soft? Okay, I'm doing above your eyelids now, sort of your eyebrow area. Prickly or soft? Okay, and on the cheekbones. Prickly or soft? Okay, we're doing the last parts here just behind the earlobes. So, prickly or soft? Prickly or soft? Excellent, I really like that. I think you got all of them right. So, for that part, we're done. The cranial nerves 5 and 6 with testing your facial sensation. Now we're going to do the strength. So, what I'd like you to do is just put your arms up like this for me. I'm going to pull on them or push them, and I'd like you to fight against them, okay? Alright, so I'd like you to put your arms up, and I'm going to push against you. So I want you to fight against me pushing. Okay, here we go. And fight, 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 fight. Okay, I'm going to pull your arms away now. So fight, 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 fight. Great. I'm going to try and spread your arms now. So put them together. And fight, 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 fight. Great. I'm going to try and push them together now, okay? So arms back up and fight, 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 fight. Excellent. Strength is doing great. Now we're going to be going on to hearing and balance, testing your cranial nerves 7 and 8. These are this is always a hard word to say, the vestibulocular nerve, okay? That's great, okay. So I'm going to be doing some hearing, and I'd like for you to let me know if you can hear them or not, okay? My goodness, my stethoscope keeps falling off. I think I need to buy a new one that attaches to me permanently. Okay, so coming in with those sounds, let me know which ear they're in, okay? Which ear? Okay. Which ear? Great. Which ear? It was both ears that time. Okay, good. Now, I'm going to do a little tap behind your ear. Tell me when the ringing stops, okay? Just need to grab my tool. It's more of a tapping, but when the tapping stops, let me know. So I'm just going to come in behind your ear here. Let me know when it stops. Did it stop? Okay, we're testing the other ear now. Did it stop? Good. So, your hearing is great. Now, I'm going to be doing your balance. So, this one's pretty straightforward. I'd just like you to sort of stand straight. I'm going to try and push you away just forwards and backwards, okay? So just stand there. It's not going to be a big push. And resist, 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 resist. I'm going to try and pull you towards me now. Okay, here we go. And resist, 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 resist. Great. No problems with your balance there. Moving on to the swallowing and the gag reflex. These are cranial nerves 8, 9, and 10. These are the glossopharyngeal and vagus nerves. So, if you could stick your tongue out for me. I'm just going to get my tool. I'm going to have a look in the back side of your throat, and then I'd like for you to say, ah, for me at one point, okay? Excellent. So, just open your mouth for me. Okay, now just say, ah. Okay. Okay, can you move your tongue to the left? And then move your tongue to the right for me. Tongue to the top of your roof. Can you make your tongue go down into your jaw? If you can't, that's okay, bud. Okay, good. I like what I'm saying. Can you stick your tongue out for me as far as you can? Sort of like that. Okay, can you roll your tongue in a circle around your mouth? Sort of like you're licking your lips. Okay, that's great. I like what I'm seeing there. Now, I just need to write this down. down in my notes, otherwise I'm going to get behind. Okay. Just bear with me for 1 second here. Great. Now, I'm just going to come in here into your throat area, and I'd like for you to swallow for me when you can, okay? Okay, so my hands are warm. They've warmed up, I swear. Okay, I'm just going to come into your throat here. Now, can you swallow for me, please? Great. Okay, and one big swallow again. Okay, I'm just going to move your trachea side to side really quickly. Just pushing it sort of to the side. Okay, that's great. Now, for the swallowing the gag reflex, that part's done. I know that can be the worst part. We're going to move on to step number 8. This is the shoulder shrug and head rotation in terms of your strength. Cranial nerves 10 and 11, the accessory nerves. So I want you to have your head straight. I'm going to try and push it this way, this way. I'm going to try and push it up and down. So have your head straight. Try and turn it to the left for me. Okay. And resist, 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 resist. Thank you. And to the right. And resist, 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 resist. Excellent. I'm going to try and push your head up. Okay. And resist, 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 resist. I'm going to try and push down. I'm just going to push on the top of your head. I apologize if I mess your hair up. And resist, 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 resist. That's great. Now, with your shoulders nice and loose, can you do a shrug for me? Nice and tall, nice and tall. Okay, perfect. I'm going to put my hands on your shoulders now, and I'd like you to do that again, okay? And now, fight, fight, fight. Push up for me. Fight, 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 fight. Keep going. Fight, fight. Okay, great. Give yourself sort of a little roll of the shoulders there. I know that can be a little hard. Now, step number 9 was actually tongue movements and strength. So we already did that, which was cranial nerves 12, the hypoglossal nerve. But I just wanted to get that done while we were doing the swallowing and the gag reflex. The last and final one is going to be sense of smell. I've got a couple smells here, and I'd just like you to let me know what they smell like. These are doing cranial nerves 12, your olfactory nerve. I'm just going to grab the senses right now. Okay, so these are my 4 scents that I have. Let me know what they smell like, okay? So the first scent, can you smell that for me? What does that smell like? That's right. Next scent, can you smell that for me? What does that smell like? The next. How about that one? And the last one. What does that smell like to you? Great. So your sense of smell is fantastic. We've gone now through the 10 steps of your cranial nerve exam. I'm just going to do one final listen to your heart just to make sure that things are good, and then I'm just going to listen for your blood pressure, and then we should be able and good to go. So just give me one more second. Just write these notes down. You're doing a great job today, by the way. I have no concerns thus far going into your surgery. Alright. That's great. So the last thing I'm going to want to do is just check your heartbeat, just to make sure it's sounding correct, because that's the most important part, the part that keeps you alive. Keeps you alive. So I'll just warm this piece up. Okay, so it is working, so I'm just going to come in here and just have a listen, okay? So I do apologize if it's cold. Okay, I'm just going to listen. Okay. Is that you? Is your heart speeding up? It was going normal. Try to bring your nerves down. Did you have coffee today? That could be it. Caffeine is a factor that creates hearts speeding up. So let's go in again and have another listen. Okay, so just breathe. Take a deep breath in and hold it for a second. I'll do it with you. Ready? And hold it. Okay, great. Your heartbeat went back to normal. Not sure what happened on that last one, but nonetheless, I'm happy with what we've gone through today, and I think I can clear you for surgery in a few weeks' time. We'll do one final checkup at the hospital when we're there, just to make sure that things are still going well. It won't be as in depth as this one, but nonetheless, we like to make sure that our patients, you, are healthy before you go under the knife. In a sense, it sounds bad to say it like that, but that's what's happening when you get surgery. So Margaret will be at the front to let you know if there's anything owing. There shouldn't be today. This was sort of a pre-exam. It was already covered by your healthcare, so you shouldn't have to pay anything. It's just more of an invoice for our business here, and then for your records as well, just to state that you were here seeing me before you went in for your surgery. So you have a wonderful rest of your whatever you've got going on for the rest of your day or evening, and we'll see you in a couple weeks' time, okay? Okay, that's great. Have a good night. Bye-bye. Hello. Yes, welcome back. You are done your surgery on your knee, that's correct. I'm going to be going through a list of questions here to make sure that you're okay, and then just go through a quick little physical exam on you to make sure that everything's good after your surgery that you've just had, okay? Okay, do you know your name? Do you know my name? Correct, Dr. Whisper, that's right. Do you know which hospital you're in right now? Okay, that's good. How is your mouth? Do you have a dry mouth right now? Okay, we can get you some water. Sure. Nurse, can we get some water for this patient, please? Okay, they'll come and grab some water and bring it to you soon. In the meanwhile, I'm just going to ask you some more questions. Do you remember your name? Now, do you remember which knee you had the surgery done on? Great. Your memory's intact. That's great. Yes, it was a success. It went very well. So now that we've got you awake, I know that you feel a little bit groggy, but that's okay. You can go back to sleep soon. We're just going to go over a couple things to make sure that you're feeling okay before we let you go home, okay? Okay, so the first thing, I'm just going to take your blood pressure really quickly just to see how it's doing post-surgery, post-anesthesia that we had put you under on, okay? All right, here we go. It's a little cold, so I do apologize. So what I'm going to do is just warm this up a bit. Nobody likes a cold stethoscope, so. Okay, now that it's warmed up, I'm just going to can you lift your arm up for me? Just going to go right underneath your armpit there and have a listen. Okay, here we go. Ready? Okay, I'm just going to go in here. Okay. Can you hear that? No, it's not a plane. It's definitely your heart. If you can hear a plane, I think we need to do a little bit more investigating. Okay, well, your heart is stable in regards to the heartbeat. That's good. So now I'm going to be listening for your blood pressure. Can you just stick your arm out for me me just like that. Okay, we're just gonna go along here to your wrist area. I'm gonna listen for your pulse through that area, not your blood pressure. I meant your pulse. Make sure in the radial arms that it's okay. So stick your arm out just like that for me, just like this. I'm gonna put it right there, okay? Okay, stick your arm out. Okay. Yep, I'm hearing it. Are you hearing it? That's good. Okay, great. So you have a great heartbeat post-surgery. That's excellent. Now, just going to be going through a few things to make sure that your vision is good as well. So I'm going to cover one eye. You let me know how it goes, okay? Here we go. I'm going to cover your eye. Now, can you see me still? Great. We're going to do the other eye. Can you see me still? Great. It's got little holes in it. Can you see through the holes just a little bit? Just a titch. Can you see me? Okay. It was a trick question. You can see me just barely, though. Great. So your eyes are good. Now we're just going to follow along really quickly. Follow my hands, okay? Follow them. Follow them. Follow them. Follow them. Up. Sides. Great. Tell me when you cannot see my hands anymore. Okay, here we go. Great. And again. And again. And again. How many fingers am I holding up? How many fingers now? How many fingers now? And last one, how many fingers? Great, your vision is intact. Again, a great means of success from a surgery on a doctor's point of view. I'm a doctor, so I definitely know what I'm talking about. Exactly. Okay, so now we're just going to go through your eyes still again, but we're going to be doing a color visual test. I know, can you hear those planes as well? Maybe there are planes outside right now. It's not just you, it's definitely, I think there are planes around the hospital right now. Okay, we've got our colors here. Tell me what colors you see when I bring them onto the screen. Here's the first one. What color is this? Excellent. And how about the second one? Great. And the next. And the next. And the next. Okay. And last. Can you see that one? Good. Now, when I was bringing them up to your eyes, were they blurry or clear? Did it take a while for it to become clear for you? No? Okay, that's great. And I just going to have a quick look inside your eyes just to make sure that they're dilating properly as well. Man, those planes outside, we need to have a conversation with those pilots. They're definitely ruining our exam here that we're doing on you to make sure that you're physically fit. Okay. Now I'm going to go into your eyes, so can you look up for me? Up like that. Okay. Excellent. That's great. Looking up. Next eye. Looking up. Look down for me. Looking down, looking down. Next eye, looking down. Okay, now just follow the light side to side. Keep following the light. Follow the light. What circle? Oh, I just told you what it is. What shape am I making? Do you know that shape? Correct, it was a square. How about this one? Triangle, excellent. And this? Circle, good. Your eyes are fantastic. I'm just going to have a feel around your face, your lymph nodes, check your hearing, just to make sure that portion is good as well. Okay, so I'm just going to come into your, just the lower portion of your jaw here, so just don't mind me. A little bit of cold hands, I apologize. Here I come. Okay, can you feel that on either side of your jaw? You can feel that on either side of your jaw? Okay, how about when I come just underneath it? Can you feel that? Can you feel when I'm tapping? Excellent, okay. Just gonna come up alongside your ears here. Just on these areas here. Can you hear that? Okay. Which ear am I doing this in? And the next. Okay, how about now? And now. And now. Which ears were you hearing those in? If you said both, you are correct. I was doing them in both your ears. Okay, next I'm going to get you to cover your eyes. And we're going to do the hearing test one more time just to make sure that your ears are hearing properly. We need you to be able to leave the hospital with good sounding ears so you can hear that traffic or you can hear that dog barking. Okay. Okay, close your eyes for me. Now, what ear do you hear this out of? No looking. Okay, and again. Okay, and how about now? One more time. And the last one. Okay, great. So your ears are intact as well. Along your jawline, there's no swelling. Your trachea is intact, which is good. You need to be able to have that intact so that you can breathe and swallow. Because you're probably quite hungry right now, I'm going to assume. Yes, the surgery, it was 6 hours, but we had to do your knee. And it's just no ordinary knee. You have a bionic knee now. You can run that 100-meter sprint. No problem now. Okay, so how are you feeling for oxygen? Do you need any oxygen? Okay, we're going to test your breathing right now to make sure that that's okay, because when you leave the hospital, you need to be able to take deep breaths. Okay, so in and let it out. And in. Hold that breath and let it out. Keep letting it out. Was that easy to do? Great. I knew that you'd be able to do it, no problem anyways. Okay. Now, I do have another test that I would like to do for you. It's just how many circles do you see on each piece of these Legos? This is so I can test your depth perception in regards to what you see from far away, but also to see if you can count while visually looking at something that's quite small. So, here's the first one I'm going to do for you. How many circles do you see? Can you see that? How many circles? Did you say 6? Great. And the next one. Tell me how many circles you see. You can't focus on it, can you? I'm really sorry that your eyes are not acting as well as they should. Let's see, there we go. Did your eyes focus? How many circles do you see? Does it get blurry as I get closer to you? Okay. Well, the correct answer was 8. Okay, and we'll do the last one here. I'm just going to do this one. You're already passing with flying colors as expected. So, how many? Man, I'm going to have a conversation with the airport authority after this. Those planes are just despicable. It really ruins the doctor-patient tests that we're doing here, so I do apologize. So, how many circles do you see on this object? Let your eyes focus on it. Okay. Did you say 4? 4 is correct. Okay. Now, before I let you go, you seem like great health. Do you have family here to pick you up? Do you have anybody to come pick you up? No? Okay. Well, thankfully, we have a bed upstairs that you can stay in tonight if you're still a little tired. Okay, and before I let you go, 5 more questions that I just need you to answer. Do you remember what you ate before you came in for surgery? That's right, you had breakfast because you were not allowed to eat before the surgery. That's right. It was a trick question and you did no problem on it. Now, the next one. Do you remember what car you drive or vehicle or mode of transport that you got here in? That's right, you were dropped off because you cannot drive after a surgery. Again, a trick question, but I know that you got that one right. Okay, and the third one. What type of drink would you like after to leave here with? You can pick any one and we'll get it for you. Remember that nurse at the beginning? Where is that nurse? She never brought you the water. she brings you anything you want when you leave the hospital. Now, that was my third question. My fourth question. Now that the surgery is over, what are you going to eat? What is the first thing you're going to eat? Wow, that sounds delicious. As a doctor, I would really enjoy if you could bring some of that back. I don't get a lot of spare time to myself, so it's nice to be able to eat in between surgeries. And the last and final question, who are you going to recommend to come get another surgery from me? Let me know. I'd love to be able to help them out, make their lives better. So when you're done, when you're leaving this, let them know about it. Let them know I can help them. Create a better, relaxing environment for them so that they can live a better and healthier life. Okay. Now, that nurse did come, but I don't think she brought you what you wanted. She didn't bring anything. I'll have to go give her a talk. Anyways, you have yourself a great night. Okay, thanks for coming in today. Sorry to call you on such short notice, but this surgery just opened up, so we need to do a quick, comprehensive, random check around your body to make sure that all the parts of your body are functioning well for this surgery that you're going into. Is that okay? Do you give your consent to that? Okay, I've just got my list in front of me here, and I'm going to going from top to bottom, and I want to make sure that everything is good before we put you in that room for surgery, okay? Okay, that's good, so I'm going to start now. Just go along with it. Let me know if there's any complications or if you have any questions, okay? Okay, good. So the first thing that we're going to do is a blood pressure monitoring test. So I'm just going to put this on. I'm going to feel your pulse in your wrist, okay? Okay, here we go. So just give me your wrist, please. Okay, and I'm just going to have a listen for it, okay? Tell me if you can hear your own pulse. I can definitely hear your pulse. Can you hear your pulse? Okay, good. I'm just going to have a little feel around your chest here just to make sure that everything's okay, okay? Okay, just going to feel around here, feeling your clavicles, making sure that they're okay, that they're sound, going down your shoulders here. I just need to make sure that they're symmetrical. Okay, good. Your blood pressure 120/80. You're set to go in for surgery on that aspect there. We're going to get to the second part of the exam now. The second part is heart and lung assessment. So I need you to take some deep breaths from me when I ask, and I'm also going to be listening to your heart rate while you're taking breaths as well, okay? Okay, so take 3 deep breaths now, really quickly. Hold it and let it out. Again, 3 quick breaths. And hold it and let it out. Okay, that's great. How did that feel? Do you feel lightheaded from that? No? Okay. So the next thing we're going to do, a big breath in. Hold it for 3 seconds. Hold your breath. Keep holding it. Hold it, hold it, hold it, hold it. Okay, let it out. How did that feel? No lightheadedness? Okay, that's good. That's good. I'm just going to have a little tap around on your backside here, so if you could just turn around for me really quickly, and I'm going to get you to say these numbers when I say them, okay? Alright, so turn around and say 99. Say 99. 99 again. And one more time. Okay, just feeling for any lumps and bumps on the backside of your ear, so just feeling down your back here. Okay, no lumps and bumps there, that's good. Now I'm going to listen to your heart, okay? Try not to focus too much on your heartbeat. I know a lot of people do, and they think it speeds up their heart, but don't worry. You just focus on you, and we'll go from there, okay? Alright, so I'm just going to put my... it's a little cold, but we're going to put it onto your chest here. I'm going to listen to your heartbeat. You just think about anything you want at this moment in time, okay? Alright, here we go. Your heart is beating a little quicker right now. I don't know if you can hear that or not. definitely starting to go up. Just try and bring your calm rate down, your rhythm down. Okay, that's good. Okay, your heart rate went back down, so that's great. Had a little bit of a scare there. I saw it go up. So far, we're clearing you for surgery. A couple more things to go in. Oh, also, my name's Dr. Whisper, and I'll be the worst person, the doctor today, performing the surgery on you, so you are in safe hands once I take you through this assessment. So the next thing I'm going to do is a reflex check. I'm going to do a multitude of checks here throughout your wrists, pushing and pulling. I'm going to do ones through your eyes, tilting your head left and right, and I'm just going to go through them quickly, and I want you to follow along with them, okay? The first thing I'm going to do here is I'm going to do your eyes. I've got my light here. I want you to follow along with it on the directions that I go, okay? So I'm going to start, here we go, and follow it down to up to down. Next eye, down to up to down. From left to right, right to left. Okay, I'm not going to tell you this time where it's coming from. You just follow along. Ready? And great. Okay. Tell me when you can't see the light anymore. Okay. And again. And again. And again. Okay, good. How is that? Let me also check your pupils to see if they dilate in and out, reflective to light. Here we go. Coming in. Okay. That's good on your left. On your right. Pupils are reactive to light. Great job there. That's good. That's the most important part, having good eyes before we go in, because they are a crucial part in the healing process. Don't ask me how. It's way too medically related to get into it now. Just trust me on it when I say that. Next thing we're going to do here is we are going to do some resisting, pushing and pulling. So put your arms up like this for me, please. Okay, and now resist, 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 resist. Pushing in, resist, 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 resist. Pushing out, resist, 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 resist. Pushing in, resist, 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 resist. Excellent. Functioning on your reflexes there. Your strength is good on both sides. Neither side had a weakness. That is really good. It shows your brain is symmetrically talking to either side of your body. Excellent job there. The next thing we're going to do is I'm going to continue this eye examination. Just a few more little tests on it. I'm just going to cover one of your eyes and I want you to tell me if it gets blurry or not. Okay, here we go. Did it get blurry for you? Okay. How about on this eye? Did it get blurry for you? Okay. Now, when I cover completely, tell me if you can see or not see. Can you see? No? Okay. Now, can you see? Is this clear or blurry? How about now? Is it clear or blurry? Okay, good. And how about myself? Am I clear or blurry? Great. Last part of the eyes here. How many fingers am I holding up? How many fingers? 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 Excellent. And tell me when you cannot see my hands. Go outside of your vision. Okay. How about now? Okay. Tell me when you can't see them on the sides. Okay. Again. And again. And again. Great, your eyes are in excellent shape. Love that for the surgery. On to the next part of the list. I'm going to be looking into your ears, okay? I just need you to turn sideways and I'm just going to have a little peek inside your ears here. Okay, here we go. I'm just having a look inside them. Just going to get my little tool here as well. Okay, and I'm just going to come and have a peek. Okay. Can you feel this? Okay. Just gonna get you to turn around. We're gonna do the other ear there. Okay, and coming back in. Can you feel this? your eardrums are intact. Love that. Now, on to the next portion. We're going to go into your nose. I'm going to get you to look up so I can look into your nose. Gotta get my bigger flashlight for this one here. Look up for me. Okay. Just gonna look in the other nostril. Okay. Have you had any nosebleeds lately? No? Good. Now I just want you to stay there. I'm gonna grab your nose, just move it around, make sure it's physically intact. No lumps and bumps inside your nose. Okay, here we go. Just gonna move it to the side. Move it to that side. I'm just gonna push on the little nubbin here up. Okay, and then I'm just gonna push down. Did that hurt at all? No? Okay, good. That's great. Your nose always needs to be open when we're having a surgery because it's the most important part. It helps you breathe, as you know. So we're going to get to the next part of the exam, the throat portion, okay? Okay. Now, I want you to just open up your mouth. Stick your tongue out. I'm going to grab my tool. Okay, so stick your tongue out, and now say for me, ah. Okay. Now can you move your tongue to the left, to the right. Stick your tongue up and down. Okay, your tongue looks healthy. No any bruises or soreness inside there throughout the last couple days. Okay, that's great. Now, on to the last couple things, and then you'll be able to set sail for the surgery room to get it done. One last thing I forgot I needed to do with your eyes. I need to test your color. Okay, now we're just going to go through these quickly. Can you please tell me what color this is? Okay, on to the next. What color is this? Okay, what color is this? And what color is this? Did you get them all right? Great. If you got them all right, then your seeing is intact. Your eyes are super healthy. Now the last few things, I'm just going to have a quick feel all the way from the top to the bottom, go through a couple medical questions with you, and then I'll have you on your way. I'll get you with your nasal cannula set up so that you're able to be breathing oxygen on your way to the surgery room. Okay, last little thing, I'm just coming in here now. Okay, I'm just feeling up above your forehead here, just going along it. And I'm just coming right down through the neck here, okay? Just let me know if it hurts at all, okay? Can I get you to swallow for me, please? I'm just gonna feel on your Adam's apple here. Okay, that's good. You swallowed at the same time I did. Good unison there, okay? Just coming down your neck more here, okay? I'm just gonna feel along your shoulders one more time. Okay, that's great. Now, medical questions, then I'm gonna have you on your way. Do you remember your name? And your last name? Your age? Your height? Do you remember your weight? Do you remember the color of your eyes? Do you remember your parents' name? Do you remember your grandparents' name? Do you remember the date? What is today's date? Okay, do you know where you are? Where are you at this exact moment? Okay, now when did you last eat some food? Okay, are you hungry right now? Okay, well, we need you to stay no food in you for a longer period of time because when you go into a surgery, we need to make sure you have no food inside you. How about water, drinks, anything like that? No? Okay, that's great. So it seems like everything's good here. Just last little things here. Are you on any medications? Okay, any smoking, drinking? Do you do that quite a lot? No? That's great. Healthy diet. A little bit of fun on the weekends. Okay, that's great. Allergic to anything? I think I asked that. No? Excellent. Okay, just gonna get this nasal cannula here all set up for you. I'm gonna put it around your head here. So just, if you just put your head down like that, just gonna put them through into your nostrils. Excellent. Okay, and I'm just gonna turn the oxygen on for you so you get a nice little of air. That's exactly what you want. Okay, now that I've gone to go get my assistant here, she's going to take you to the surgery room. I wish you nothing but good luck. You don't need luck, though, because I, Dr. Whisper, am your surgeon today. I have you in the best care possible. When you wake up, you will feel refreshed. You will feel like a new person. We'll see you when you wake up. Bye-bye. You must be hungry, having been in this medical bed for so long already, prior to your surgery that you're going to be commencing and having today. That's right, yes. Nothing to worry about for the surgery, though. I do, however, just need to go over an exam on you before we bring you in for that surgery. Sort of a pre-anesthetic sense exam, because we need to make sure that you're healthy so that when you go onto that table, you're in the best possible hands, but we need to make sure that your health is in the best possible way that it could be when you go into that room. Okay, so I'm going to be doing you took the words right out of my mouth, a cranial nerve exam. That's right. So, have you had one done before, possibly? You have? Okay, so you sort of know the process and the steps. Okay, I do them a little differently, but that's okay. It still is the process of the cranial nerve exam, just I have a unique set of utensils that I used in order to test those nerves. Okay, so first things first. Let's be sensible and safe and put on our gloves. Great. Yeah, I will be right back. Yeah, I'm back. Just needed to get a different set of gloves. These ones had ripped and they were in the cabinet over there. Great. So the first thing we're going to do is I want to make sure that your body is oxygenated. So I'm going to be using this nasal cannula and I'm just going to be putting it over you and I'm just going to be administering some oxygen to you. I do apologize. This hospital is near an airport, so if that's what you're hearing right now, it's temperamental. It's temporary. It's okay. So let's focus on this. So I just need you to be comfortable. I'm going to put this down and into your nostrils, just this nasal cannula here, and then we'll get on with it. So just tilt your head up for me a sec there. Great. Okay. Just gonna place that just inside your nostrils there. Okay. Okay, now let's turn on the oxygen. Just gonna turn that valve. Okay, you should feel some oxygen going into your nose. Do you feel that oxygen going into your nose right now? Great. Okay, yeah. I'm just gonna make the line go down and around so that it's not fully on your body. I need to be able to see what I'm doing here. Okay, now that you're comfortable, you're oxygenated, or you're getting oxygen, let's start this exam. So the first thing that I'm going to be doing is just having a feel around your face, just looking for any lumps and bumps, and then we'll get on to the cranial nerve portions. So I'm just going to come in here. Now, I want to make sure, are you all right with me coming in? I'm just going to be feeling around your neck and everything. Is that okay? Good. Okay, so I'm just going to be feeling around the sides of your jaw and just coming down along your chin. Okay, just back up. Feeling along your forehead. Great. No lumps and bumps there. I like what I'm seeing. Just gonna feel down along your Adam's apple now. So just tilt your head back for me. Just feeling down. Okay, I'm just gonna put my hand on your Adam's apple. Can you swallow for me? Great. Thank you. Okay, so no lumps and bumps. Let's get into this portion. So the first thing that I'm going to need to do is I'm going to be looking at your eyes today. So I'm going to be doing a series of movements. I'd just like you to follow along with them. Blink as normal as you'd like. If you feel your eyes becoming watery, we can take a little break for a second. So I'm going to be looking at the dilation of your eyes right now on your left and right eyes, okay? Okay, so just be normal, blink as you need, and then look at the light. Okay. Pupils equal and reactive. Pupils equal and reactive. Good. I'm going to be going up and down, left to right, side to side. Just follow along, okay? You won't know where I'm starting from, but just do your best to follow along. Follow along. Keep following along. Great. Any pain or discomfort there as we're doing those eye movements? No? Great. We're going to do a little series of tests where you follow my fingers. You tell me when they get blurry or when they become in focus to you, okay? So first of all, just follow my fingers here. Now, when you're looking at my fingers, are they focused? Are they blurry? They're focused, okay. Now, as I move them away, do I become in focus? Let me know when I'm in focus. I'm in focus now. Okay, good. I like that. Your depth perception is good. I'm going to start on the outside out here. You let me know when my hands become in focus. Okay, so as I come in, let me know when they're in focus. They're in focus. You can see me moving them. Great, and I'm going to come back. Tell me when I'm in focus. I'm in focus. Great. Depth perception. No problems there on that cranial nerve exam. I do apologize. It must be a busy day at the airport. There are just a lot of planes taking off today. Let's do our best to just concentrate on each other during this cranial nerve exam. Okay, so I'm going to come back in. I'd like you to look up for me as I examine your eyes, okay? So just tilt your eyes. This is where I need you not to blink. Actually, what we can do just to help open your eyes more is I've just got some medical tape. I'm just going to tape up your eyebrows right there. Okay, that one. And just tape up this eye as well. Okay, great. Eyes are a little open now, I can see that, but that's okay. It helps me look into your eyes more. So, as you're looking up now, please. Alright, and looking up. Looking up, thank you. Looking down now. Looking down. Keep looking down. Okay, looking up. Okay, looking down. Looking down. Great. I'm not seeing any macular degeneration or anything. You must eat a lot of carrots and get your vitamin D, don't you? You do, good. My assistant is just calling me. I will be right back. I do apologize about that. Being one of the only doctors in this hospital, I get called on a lot, so I do apologize. Now, where were we? Just doing the eye exam, okay. So, now that we've done that part, I'd just like you to just let me know. I'm going to put up fingers at random. I'd like you to tell me how many fingers there are at a time. Okay, ready? And how many fingers? ears. Great. No problem with your counting there on that cranial nerve, so like what I'm seeing so far. Now I'm going to be coming into your ears now, and I'm going to be listening to your left and your right ears, doing some audible tests. You let me know if you're having any troubles hearing, okay? Alright, so I've got a new device that I've got. It's quite a nice device. It's very simple. They are medical grade pens, but they send out, my language today, they send out audible noises that are quite nice to listen to, but they help me help you to know which ear we're out of. So you let me know which ear you're hearing it from. Which ear was that? And again. Which ear? Great. Sorry about that little frog in my throat. Now we're going to come in and do it again. Let me know if it's equal in both ears. Was that equal in both ears? It was. Great. That's excellent. I don't need to do really much more of the hearing test on that. That's more just to make sure that your ears are working. So what I'm going to do is I'm going to be doing the prick test where you let me know whether it's sharp or soft on select points of your face. I've got an item here. It's not super sharp, as you can see. It's just got a little bit of a point on it. And then I've got a Q-tip. Just your standard Q-tip. You let me know when it's sharp and when it's soft, okay? I'm not going to tell you what I'm doing. You let me know. So I'm coming in on your left cheek here. So here we go. And was that pointy or soft? Okay. And we'll do it again. And there we go. Pointy or soft. Okay, so you're doing well so far. And pointy or soft. Pointy or soft. Great. And we're going to do the right cheek now. Pointy or soft. And again. Pointy or soft. Okay, here we go again. Pointy or soft. And again. Pointy or soft. Great, you only got one wrong. I forget which one it was, but I remember that you got one wrong. All of the rest were right. Now, I'm just going to be coming along down onto your shoulders and into your arms a bit, doing the pointy and the soft as well. So you let me know. Okay, so ready, and pointy or soft, and pointy or soft, and pointy or soft. Great. Onto the other side. Pointy or soft. Pointy or soft. Pointy or soft. Great. Cranial nerves are intact. Now, I need to just open your mouth. I'm just going to have a quick little look inside. I do apologize. I've seemed to have split my glove open. I'm just going to make my way back to the cabinet and just grab another glove. 1 second. Okay, I'm back. Sorry about that, but safety is paramount here, so I needed that new glove. Now, where was I? That's right, I was going to get you to open your mouth so I can just have a little peek inside. Okay, so just nice and wide, and go, ah, and stick that tongue out like this. Ah. Great. Good, perfect. Yes, I saw those lights as well. Those are the ones I have in the back, so I can really make sure that when I'm looking in your mouth, yes, that one there. That's so I can really see in your mouth quite well. Okay. Can you move your tongue to the left? And to the right. Tongue, top of your roof of your mouth. And can you put your tongue into the bottom? Yeah, just like that. Excellent. cover one of your eyes, okay? Coming in on the left eye. Now, coming close. Am I blurry? Oh, I'm still not. I'm not blurry. Good. Now, the other eye. Am I blurry? No. Excellent. I love that. I'm going to be coming in. I'm going to cover both eyes, and then I'm going to remove it super quickly. You tell me if I'm blurry or not. So, covering your eyes now, and then I'm going to let go, and then you let me know if I'm blurry or not. Was I blurry? No, I was always in focus. Great. Your eyes react to light very quickly, sort of like, just like that. That's great. Now, on to some of the color tests that we have before I listen to your heart. Yeah, a very important thing to listen to, but we're just going to make our way down. So, I've got an array of colors. Very simple. You just tell me very quickly what color they are. What color is this? And what color is this? What color is this? And this. Lastly, this. Now, you tell me, how many colors do you see? Very quickly, you have to tell me, how many colors do you see? I'll let you focus. Did you get it? Yes, the answer was 5. Great. So, color test. I like what I'm seeing. I'm going to do one final test. It's just going to be on the back sides of your ears with my audible tools. Let me know if you can hear these noises from the back side of your ear when noises aren't coming in, like these planes above us today. Okay, here we go. I'm just going to come in behind your ears here. Let me know if you can hear them still, okay? Could you hear that? I'm coming just behind your ears again. You can hear that? Okay. And now I'm going to come from behind your ears forwards. You let me know when it becomes more audible as opposed to less audible, okay? All right. Now, it was more loud then. Okay, we'll try that again. Tell me when to stop. Same spot. Good. Your ears are excellent at listening. Now, how's that oxygen doing in the cannula that I gave you in your nose? It's doing good. Okay, yeah. Your surgery's in about 25 minutes, so I'm just going to do the last test here, listening to your heart. A couple breathing techniques to make sure that your lungs are okay, and then we'll have you on your way. Okay, so, I do apologize. It's a little cold. Okay, I'm just going to come in here now. I'd like you to just breathe normally. I know that when we say to breathe normally, you start to nod. So just pretend like you've won $50 million and you're spending it in your head. How's that sound? Great. Okay, so just going to listen to your heart now. Excellent. I like what I'm hearing, a steady beat. Now, I'm going to ask you to take some deep breaths in. I'm going to be listening to the upper, middle, and lower quadrant lobes of your lungs. Okay, so deep breath in for me, please. Thank you. And in. Hold it. Okay, and out. And again, in. Hold it. And out. Last one, in. Hold it. And out. Great. assistant, where she'll just give you all the details of what the surgery will entail. When you're done the surgery, I'll be coming back to follow up with you. Maybe not right away, one of the other doctors will, but I'll be following up with you in a few weeks about this surgery. And that is right, it is a surgery. You guessed it, we did cranial nerves. It's on your brain. So the next time I see you, you'll be coming back for that post-op checkup from the surgery that we're doing inside your brain. Do you have any questions? No questions? Okay. Now, the last thing, it was a memory test. I just need to ask you a couple questions to see if your memory is intact for that last and final cranial nerve. Starting off simple. Do you remember your name? Good. Do you remember your age? Good. And your year of birth? Great. How many colors were there that I showed you? Do you remember? Okay, good. I'm glad you remembered that. How many colors did I show you at once? Yeah, good. Alright, your memory's intact. I'll be heading off into the surgery room to prep myself now. Margaret will finish off all of the rest of the preliminary things to get done. A little bit of paperwork, some signatures, and I'll be seeing you in the surgery room. Take care. Bye-bye. Hi there. Thanks for waiting. I do apologize. Our clinic is just swamped today. But thank you for coming in, and it is now your turn. We'll be doing an eye exam today, is that correct? Great. I am Dr. Talk. Dr. Whisper's not able to make it in today. He's feeling unwell, so he's asked for me to step in to do this exam for you. So we'll be going through a multitude of examinations today, steps of seeing how your eyes work, testing your reflexes in regards to your eyes, how you see both near and far, and at the end of it, I'll give you a prognosis on how I believe your eyes are. How does that sound? Excellent. So the first thing that I need to do is just going to write down a little bit of information that I'm going to get from you. Okay, I'm just going to go over your birth date, your name, and everything with you so that I can make sure that I have the correct patient file in front of me. Can you let me know your name? Great. And your date of birth? Great. And your approximate weight, has that changed recently? No? Okay. Still the same? Okay, I do apologize. We do live near an airport, so let's just pretend like we don't hear helicopters or planes going over us at these times, but that's just the way it is when you live in a busy city, unfortunately. So again, like I said, you've given me your weight, your height. That's still the same? Great, that hasn't changed. Perfect. Any dietary restrictions that have changed since you've last been here? No? Okay. Prescriptions, medications that you're taking? No? All right. Anything else I need to get in here? Any recent surgeries? Great. And just overall, how do you feel like your eyesight has been since I've seen you those last 6 months ago? No changes? Most people get an eye exam every 2 years, but seeing that just on your past recent medical history, Dr. Whisper has requested to have it done every 6 months. So we'll go through an array of examinations to make sure that it's still the same and hasn't gotten worse since the last time that you were here, okay? All right, just gonna write down a couple of extra pieces here. Great. So the first thing that we need to do is I'm just gonna have a peek inside your eyes, okay? How does that sound? Great. So I need you to just open your eyes nice and wide. I need you to see this light, this pen light. I just need you to follow it as I go up and as I go down, from side to side, both left to right and right to left, okay? Great. So when you see the light, let me know. Great. Let me know when you see it again. Excellent. And let me know when you see it again. Great. From the outside, and excellent. So peripheral vision looks to be great. A couple more examinations I'm going to do before we get really deep into it here. I need you to let me know when the light, the pen light, both comes towards you and away from you. Very simple, but it's part of the examination. So, is the pen light far or near? Great. How about now? Far or near? Great. Was it clear when I was close to you? You're not sure? Okay. So tell me, does the pen light and my hand get clear or not? It's clear? Great. Am I in focus? Excellent. Now back here, can you still see that pen? Is that in focus for you? Excellent. Your peripheral vision, you are both far and nearsighted, is great. No changes there, so I'll mark that down in the book. Get to that page. Okay, so far-sighted, still the same good. Nearsighted, still the same good. Peripheral vision, still good. Excellent. So far, things are all looking great. So I'm going to be coming in again, but we're going to be doing different sequences here where I ask you to tell me when you can't see things anymore, okay? So we'll be starting, instead of things coming into your vision, they're going to be leaving your vision, and you're going to let me know when you can't see them anymore, okay? I've got 2 pen lights going. So tell me when you cannot see the lights anymore. Can you see them currently? Excellent. Tell me when you cannot see them. Great. And again. And again. Excellent. And again. Excellent. So both top and bottom, left and right, excellent in regards to things leaving your vision of field. We're going to be going into the corners of your eyes, up here, down here, and down here, all right? Okay, so tell me when you can't see them anymore. Great, and again. Excellent. I like what I'm seeing so far. As you can tell, it's a beautiful day outside. That window behind us is just bringing in so much light. I love it. Okay, let's update that booklet again. So, both axial on the x-axis is good, and the y-axis is good. So far, Dr. Whisper's going to like what we're seeing so far. No changes in your eyesight. Now, we're going to be covering one of your eyes, and we're going to be looking at it in regards to, do you have astigmatism? Can you see properly out of one eye, the other eye, which then gives you good focus on both eyes. So I need you to close either eye, just so that I can make sure that we're closing the correct eye. I'm going to get you to close your left eye. I will put this over your left eye, and you let me know if vision goes blurry or if it's sharp, okay? All right, I'm coming in here. Let me know if you can still see properly. Can you see my face? Good. And is my face clear still with this in front of it? Great. We're going to do the other eye now. Now, going in here. Is my face still clear? Looking at your right eye here, is my face still clear behind this item? Great. I like what I'm seeing there. So, no problems there either. That's, so far, I like this. You're a good patient. You take care of your eyes. Do you eat carrots? You don't? You must just have good genetics then. Okay, so with the tool both forwards and backwards, I'm still clear in the background with the item in front and the little right eye. And I am still clear on the left eye with the item in front. Great. Now we do have some new items here that we've come into. They're very high tech. This is an optic red laser eye scanner. So, very high tech. I'm going to be putting it in front of your eyes, and I just want you to look up and then look down when I put it in front, okay? So, can you look up for me? All right, looking up, then looking down. Other eye, looking up, and looking down. Great. That's step one of this machine. It can do multiple things. That was looking into the back of your retina, making sure that it's intact and it's still attached. Now, we have all this new technology, which is great, but it's always good to go in and do manual checks with the light because my eyes can physically see what I'm looking at. So I just need you to look up for me, and I'm going to come in and look, okay? Okay. I like what I'm seeing. Coming in with the other eye there. Looking up there, please. Great. And down for me. Okay. Looking. Okay. Other eye. Down. Okay. I need you to make your eyes as wide as you possibly can, okay? I'm going to be testing your dilation, your pupil dilation. How is it reacting to light? Okay, so eyes nice and wide. I'm going to come in with the light. Great. Coming in again. Great. One more time. Excellent. I'm going to be coming into your right eye now. Coming in. Great. One more time. Final time. Okay, you can blink now. Sorry about that. I just need you to have your eyes as wide as you can so that they let in as much light so I can see how they react to my pen light. Okay, let's write down that information. Left eye reactive to light. Right eye reactive to light. Okay. Just gonna get a little close in here. I'm just gonna feel around your eyes, okay? All right, so if you can just, is it all right if I do that? Okay. I'm just gonna come into your left eye here. So just keep your eyes open. I'm just gonna be feeling around the outside of your hand there. And the other side here, just feeling around the eyes. Okay. I'm just gonna feel underneath the just underneath the eyes here, okay? On your, okay. Okay, just look up for me, please. Just gonna pat underneath the eyelids there. And patting under the other eyelid. Great. No puffiness. How have your eyes been for redness? Are you getting enough sleep? No puffiness in eye right. No puffiness eye left. Great. Now we're going to do our eye test. We've got our standard sheet here. I need you, when I point to it, to tell me what letter you see, okay? All right, what letter am I pointing to? Great. How about this letter? And this one? And how about this one? And this one? And this one? You could read those all easily? Great. How about this number? And this number? And this number? Great. Let's go a little bit farther down. We're going to read that. Can you read that number to me? Great. Can you read that letter to me? How about that letter? How about that letter? That one? And that one. And the final one. Great. Now we're going to get a little bit to the very small writings. If you cannot read them, that's okay. Our eyes can only see so good. All right. Can you read that letter for me? How about that one? And this one? And this one? And this? And that. Great. What number is this? Excellent. 20/20 vision so far. I swear, you must eat carrots. Because you can't have vision like that without eating carrots. 20/20 vision. Eye chart. Excellent. You're going to get a gold star today. Dr. Whisper is going to be so proud of your eyes over the last 6 months. I really like what I've been seeing. We're going to come back in with our high-tech tool. It's just going to do a quick laser looking into the very back of your eyes. So just stand still and try not to move. Okay, tell me when it's in focus for you and then we'll start the exam. It's not in focus? Okay, how about now? How about now? Really? Your eyes are not focusing. Let's try that again. Is it focusing on you? There we go. Yeah, sometimes the eyes take a little bit longer to focus. So I need you to look up. Okay. And I'm just going to tilt the camera looking down into the back of your eye. And we're going to start the exam. Stay very still. Great. Okay, we're going to go looking up. I need to look up. Great. And same thing again, looking down this time so I can look into the tops of your eyes. Ready? And hold still. Excellent. Let's see what that machine tells me. Okay, so that's looking good. A+. At least if it could give an A+, that's what you would have got. Let's put that cover back on. This is a very expensive technological tool that we have. So, put the cap back on that. We'll write down the last little bit of information here. Laser shows no macular degeneration. Eyes are excellent. Seeing capabilities. Now, before we finish up this exam, do you have dry eyes ever? You don't? Okay. I was going to say if you needed some type of prescription, I can always give you something if you get dry eyes. We are coming into spring. We are coming into allergy season. But if you don't have allergies, we won't worry about it. Great. Okay, so the last and final test, just before I let you go here. Just a simple color test. I'll hold the pen light up. You tell me the color that it is. Once that's done, I'll be able to let you go. Okay, so I'm going to put this pen up. Tell me when it's in focus. When it's in focus, let me know the color of the pen, okay? Okay, so can you see the pen? Great. What color is it? Excellent. On to the next pen. Only tell me the color once it's in focus. Okay. Here we go. What color's the pen? Great. 2 for 2. Again, wait for it to focus. Wait for your eyes to focus. Is this one taking a little longer for you to focus? Let's see. There you go. Did your eyes focus yet? Great. 3 for 3. Wait for your eyes to focus. And wait for your eyes to focus. Great. 4 for 4. On to the final one. Wait for the focus. Did you get all the colors? You did. Great job. Let's put those in our notes, and then I'll be able to put you up to the front desk to speak to Margaret, and she can get you in another 6 months. Color test. 5 for 5. No color blindness. All right, see patient 6 months from today's date. Great, you're all done. You can go see Margaret at the front. She'll book you in 6 months' time. You may see me, Dr. Talk. Dr. Whisper may be back to be doing the exam for you then. It's been wonderful seeing you. Be safe and have a great day. Take care. Bye-bye. Welcome back. I really hope that you're feeling better over the last 3 months since you've had your surgery. How are you feeling? You feel better? Good. That's exactly what I want to hear because I was the one that did the surgery, if you recall. How's the knee? That's where the surgery was done, but if the knee is feeling okay, then I'm just going to be doing an entire full body exam today on you just to make sure that everything is crystal clear and healthy on you. It's going to be a thorough exam today from top to bottom on your body, making sure that all of your joints, all of your peripheral visions, everything works. So I need you to be patient with me, and I need you to stay there as long as you can to make sure that you can see the full examination through. How does that sound for you? Great. So the first thing we're going to be doing is I'm just going to be looking at the top portion of your head, going over some cranial nerves, seeing how those look, your eyes, teeth, hearing, facial structure, making my way down your neck, into your arms, into your center of your body, around your waist, down your legs on either side, into your feet. We'll then be looking at your back, just very briefly, and then after that, Margaret will be able to see you at the front to book you for your 6-month follow-up. How does that sound? Excellent. That's what I like to hear. So we are going to start with the face. So I'm just going to grab my pen light, and what I want you to do is the first thing I'm going to look at is your eyes. Okay, so Yep, we've done this before, I know, but it's the standard medical doctor's examination process, sort of the routine that we're going to follow. So just, stand there, nice and tall, eyes open. Tell me what side this is coming on when you see the light. What side was that on? Okay, and again, what side was that on? Great. I'm not going to tell you if I'm coming from the top or the bottom this time. You're just going to see the light, and I want you to tell me if it's top or bottom. Okay. Was that top or bottom? Okay, and again. Top or bottom? And again. You can see my arm moving, but that's okay. It's just to make sure that your motor functioning skills are looking good. I'm just going to come really in close and look at your eyes. So can you look up for me for a second, please? Great. And then can you look down? Looking down. Thank you very much. That's excellent. And then looking up again. Just great. And down. Can you tilt your eyes that way a bit? Yeah, look sort of that way. Okay, then look that way. Okay, tell me when you can't see these eyes anymore. Sorry, these fingers. And excellent. How many fingers do you see? 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 Great. Just going to do the last little test here on your eyes to make sure that they dilate. So just stand there, eyes open for me, please. And coming in and out. In and out. In and out. Same thing, other side. not see me anymore? Great. Just cover one eye for me. And cover one eye for me. When I did that, was I blurry or clear the entire time? Okay, good. Just wanted to check to make sure that your depth perception was good. So I'm happy with your eyes so far. So the next thing I'm going to do is I'm just going to have a peek around your jawline here, down around your neck, your ears, and then we'll do a hearing test in a second, okay? How does that sound? Great. So I'm just going to have a quick look at your jawline. Just, thank you. Okay, and I'm just going to look along the back sides of your ears here. And the other side. Okay, I'm just going to look on your forehead here. Okay, I like what I see. No deformities or anything, no skin lesions or skin tags. Now I'm just going to be doing a little test on either ear. So when you hear a noise, let me know, okay? Which ear is this in? Great. And now. And now. Excellent. Tell me, what is this noise I'm making? Okay, and how about the other ear? That's right, snapping. Now, what type of noise is this? Sort of like a rummaging in the other ear. Again, what was that type of noise? Sort of like rubbing your hands together type thing, right? Good. Now, can you just look up for me? I'm just going to have a look at your Adam's apple. Okay, look sort of up just like that. Now, can you swallow for me? Just like this. Really emphasize your Adam's apple. Okay, swallow. Great. I'm just going to push it to either side. Have a look here. Just pushing her to the side. To the side. Great. I like what I'm seeing here. Nothing wrong with your facial structure. Your hairline looks good. I'd say so far on the head portion, we're good. The last thing, I just want to look inside your nose quickly, and then I just want to look inside your mouth. So if you can just tilt your head back a bit, just kind of a peek inside your nostrils. Okay. Can you just close one nostril? Okay, now can you just breathe out of that nostril for me? And do the same on the other one. Excellent. Now, just open your mouth for me. I'm just going to have a little peek inside with my mirror, okay? So, can you just open your mouth and sort of stick your tongue out like that? Thank you. Okay. Okay, tilt your tongue to that way. To the other way. Put your tongue on top of your roof of your mouth. And then, can you put your tongue like as far down into your mouth as you can go? Okay, can you stick your tongue out and say ah for me? Great, I like what I'm seeing. Let's move on to the shoulder area now. Shoulder and sort of till the middle of your chest, stomach area, okay? So I'm going to be doing some motor functioning skills, getting you to shrug, getting you to resist, both forwards and back, okay? Alright, so on the count of 3, I want you to push your shoulders up while I push down, okay? On 3, 1, 2, 3. Now push up, 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 resist, resist, resist. Great. Now I'm going to try and push your shoulders up. I'd like you to try and push them down, okay? And resist, 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 resist. Great. I'm going to do one shoulder. I'm going to push down, and I want you to resist, okay? Okay, so put that shoulder up for me, and I'm going to push down, and resist, 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 resist. Do the same on the other shoulder, and resist, 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 resist. Both shoulders up like this for me, and resist, 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 resist. Great. Motor functioning skills, muscle, no imbalances. I like what I'm seeing there. Just get a little poke along your clavicles here, okay? Just looking for any this all nice and warm, so just, yeah, breathe normal, okay? Great, I like what I'm seeing there. Now, I'd like you to just take some deep breaths. 5 breaths in, 5 breaths out while I listen again, okay? Alright. Just gotta find the spot here. Great. Two more breaths for me, please. Great. Nice and steady heartbeat, about 65 beats per minute. That's nothing bad. That's actually a really nice range. Are you a smoker? Have you picked up smoking at all since I saw you last? No. Any medications changed? No. How's your diet been? Good. Not a lot of cholesterol. Good. That's exactly what I like to hear. How about like butter, fatty foods? You've been trying to eat healthy? That's excellent. I really love when my patients try and eat healthy. It definitely makes my life a lot easier. Now, I'm just going to have you turn around for me really quickly, and I'm just going to examine your back, and I'm just going to ask you to say a couple phrases for me while I listen with my stethoscope again, okay? Okay, so just turn around for me. Okay, I'm going to put it on 6 sections of your back on the top, like this, sort of like 2, 4, 5, and 6, just like that. And then I'm going to get you to say the words 99 for me, okay? So go ahead and turn around. All right, just put that on your back there. Now can you say 99 for me? Okay, and again, say 99. Just coming down to the center of your back now, 99. 99. Just on the lower portion of your back, one more time, say 99. And last time, 99. Great. Lungs sound great. Both bilateral. Breaths sound normal. You have about 15 to 20 respirations per minute. That's exactly what we want. Nothing higher, nothing lower. So far, I'm really liking what I'm seeing. Now, I'm just going to be looking for any lumps and bumps along the front and then the back side of your chest and your back right now, okay? So, if you just sort of stand there nice and tall for me, please, okay? So, my hands are clean and they are warm. I did warm them up, but we'll do it one more time. Hands are now warm. Okay, so I'm just going to be coming alongside your lats here. Just down along your midsection. On the front side here. Just going to be feeling along in your stomach. I'm just going to do a couple taps where your pancreas, your liver, stomach, and everything is okay. So if you can just stand there, I'm just going to do a couple taps. Just coming up along to your chest area. Do a couple more taps here. Great. Doesn't sound like there's anything going on in there. No distensions or anything. Just turn around. Gonna have a quick look at your backside. Okay, gonna do the same thing I did on the front, just looking from the bottom up. Okay, so. Like what I'm seeing so far, very healthy, and your weight, just looking at your chart there, has been very stable. You've obviously been listening to my recommendations on what I've been saying to do the last 3 months. I'm sure at the 6th month, no problems. Now, I'm just going to be looking at your legs from your hips downwards. I don't need to come close to you at all. I'm just going to get you to do some movements for me. I don't need to feel or touch, okay? Alright, so I want you standing straight. I'd like you to lift your right leg for me. Can you do that? Great. And can you lift your left leg for me? Great. Can you put your left leg out like that? Sort of like that. Exactly. And go ahead. that again, sort of like a teeter-totter. Go ahead. Great. And can you squat down for me? Okay, that was good. Any creaking in the knees since we did that surgery? Did that hurt at all? No? Okay, good. Now, with your feet, can you sort of just take them and do them in circles like that around your ankle for me? Yeah, go ahead. Okay, and the other one. Any pain there? No? Okay, I heard a little pop. Oh, okay, it was just cracking, sort of like cracking your fingers, is that right? Okay, no problems there. So just turn around for me for 1 second. I'll just examine the backside and I'll get you to do a couple more movements. Okay, can you bend down and touch your toes? Great. Any pain in the back of the hamstring there from when we did that surgery? No? Okay. And just go ahead, put your leg out again like that, facing that way. Okay, your backside looks good. Normal, equal on both sides. Go again and do that on the other side. Okay, good. I'm looking at the center of your back there, just seeing how the hip movement is. Is it equal? Is one going a little cockeyed to the other? No, but I like what I was seeing. So you can turn back around for me, facing me, and I'll just get you to have your hands up and then touch your toes. Any pain with that? Okay. I'm going to get you to turn this way for me. Go ahead. And I'll get you to turn that way for me. Go ahead. Any discomfort with that? No? Okay. Now I'm going to get you to put your arms up for me. We're testing your motor function skills in your arms and then in your biceps and your triceps. So arms up like this for me. I'm going to push my hands towards you. You are going to push towards me. Okay, so here we go. I'm pushing onto your arms right here. I'm going to push and resist, 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 resist. Excellent. No problems there. Arms up again. You're going to be pulling yourself towards, like you're doing a bicep curl, and I'm going to be pulling away. Okay, arms up for me, and resist, 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 resist. How was that? A little bit of discomfort in the bicep. Okay, is that just, you did a workout yesterday. Okay, that makes sense why your arms would be a little sore, but no problems there, right? Great. So what I'm going to do now is I've got a new tool, actually just a laser that it sort of scans your body in whole, and it just looks for anything that might be going wrong on the inside that I couldn't see. So it's actually a brand new machine that we got. I'm pretty proud of it. So just got to start it up. One comes out. Okay, yes. Okay, so now I would like you to just stand there and I'm going to go up to bottom, down to top. Okay, here we go. And I'm just going to come back up now. Just going to read what the machine told me. Like I thought, nothing is wrong with you. It's a very detailed machine that gives me a lot of information in a short period of time. So other than that, we've gone through quite a few things. I forgot to do the color test. So let's do the color test just to make sure that your eyes are doing good. Can you tell me what color this is, please? And this color. This color. And this color. And the one in my pocket here. Where did that one go? Here it is. This color, please. Excellent. Now, how many am I actually holding here, and how many colors do you see total? The answer is 5. Great. So, with that being done, we've done sort of a full physical exam on you. I like what I'm seeing. Your diet hasn't changed. It sounds like you've done a fantastic job on listening to my recommendations over the last 3 months. So I'll see you in another 3 months. And with that being said, Margaret is just at the front there. She'll let you know what you owe for today if you have your provider's card ready for her. But other than that, I like what I'm seeing. You don't need to be here any longer. Go and enjoy yourself. We'll see you later. Take care. Bye-bye.